This is Kisumu City, a thriving urban center at the shores of Lake Victoria with a population of about 1 million inhabitants. Because of the existing policy of free primary education in Kenya, many people thought that most school-age children in Kisumu were going to school. KMET undertook a research which revealed that indeed there were thousands of children who ought to be in school but are not in school. As a result, KMET, with the support of UNICEF, embarked on a program to correct this situation. In partnership with Ministries of Education and Health, the City Education Directorate, and communities in the informal settlements of Obunga, Manyata, Nyalenda, Manyata Arab, and Bandani, KMET has been implementing a project aimed at getting the most vulnerable children enrolled into schools and complete 9 years of basic education. The primary objective of the active inclusion of the most vulnerable children in education project is not only to increase access of children to education, but also to retain them till they finish standard 8 in school. KMET managed to do this in 5 slum areas of Kisumu City.
We have 3 components, and each component has its own objective. So the first component is the ECD component, that is the early childhood development and education component, that ensure that children that are below 4 to 5 years of age are able to access and complete their education. Then we have the primary component that ensure that the most vulnerable children, especially the marginalized children, are able to complete also their basic education. Then we have the third component, that is the social mobilization and advocacy component, that deals with an aspect of partnership and networking and also lobbying for resources.
We set out to identify and enroll over 12,000 most vulnerable children living in the 5 informal settlements back in school. We have achieved that goal and even surpassed our target, because we so far have been able to enroll 13,000 children. Out of this total, we had anticipated to enroll 3,900 children at the early childhood education level, the same number at the primary school level, and we have also surpassed the early childhood target by almost 300 children, and the primary one by almost 200 children. So I could say that we have achieved our goal.
But early childhood education is not just about going to school.
It will also be good to let participating communities know that the project is theirs, so that it is their responsibility to sustain the MVC project. These are their children, the children in the community. They're not KMET children, because that was initially people thought that these are KMET children, so we leave them for KMET. So I think that is also one. Then another thing also I wanted to say that income generating activity was part of it as a way of supporting the MVCs. I want to say that we should also continue training and retraining, so that the income generating activities that have been initiated should grow on further, so that through those income generating activities the children can be retained.
We don't want to have interventions that we take to the community like a prescription. It's only hospitals where you go and you are given something, a drug, whether it's bitter or not, it's a prescription. But with education intervention, we want them to own the process so that we are assured of sustainability.
Nikizungumzia kuhusu binti wangu wa kwanza ambaye ni Adija Abdalla, wakati tulianza na KMET alikuwa darasa la 7, na kufuatana na vile nilivyo kutokea darasa la 7 kufika darasa la 8 nilikuwa singeweza hata kupata mapeni ya kumregister naye, lakini vile tulipata grant, tukakaa kina mama, tukaanza feeding program katika shule yetu. Tukakaa tukasema kuwa hii feeding program tutaweza kuweka 10%, na hii 10% ndio itaweza kusaidia watoto kama wale wenye wana uwezo ya kwenda shule, wenye wana hamu ya kwenda shule lakini hawana uwezo ya kujinufaisha katika masomo.
Children who are totally unable to go to school are taken care of by nyanyas, a group of women trained by KEMET to provide daycare for them. Social mobilization is a key component of KEMET's drive to achieve the goals set out in this project. 2 roadshows were organized to sensitize parents to take their children to school.
Where there is a will, there is a way. And that's one thing I like about KEMET. And the other thing about our partnership with KEMET, as I've told you, we are in partnership. They wrote to fund. You know, there are people who when they hear that UNICEF funds KEMET, they imagine that KEMET just that, and UNICEF brought the money and now raised all their staff and they own the money and now they are not even building all the schools in Kikumu. That is not the case. Once we are saying it is a partnership, everything we are sharing.
There are many teenage mothers who were unable to finish school due to their socio-economic condition. KEMET identified some of them and enabled them to attend catch-up classes until they do exams.
We discovered that there's a lot of interest among teenage mothers to go back to school. But they are not able to go back to school because the school program clashes with their own socio-economic activity programs. So what we have done is to create evening classes and weekend classes for these girls. And working with the city education office, we have gotten teachers to teach these children, and 10 of them are now are going to be sitting for the KCPE this year.
Nimesoma mpaka class 7. Ile nilifika class 7 ndio nilipata mimba kama na niko class 7. Nifanya kazi ya kuuza materials. Pesa yenye napata hapa ni kidogo sana. Na hiyo ndio natarajia nitafute chakula, kulipa nyumba, mavazi. Mtoto pia ninayo. Wenye nilipata hapo walinikaribisha sana. Walimu na wakubwa hapo walinikaribisha, wakaniuliza maswali vile nimesoma, bali nimesomea, mwaka niliacha shule, vitu kama hizo.
Mentorship is an integral part of the MVC project. Mentors have been identified and trained to inspire children in and out of school. A manual has been produced as an official guide to the whole mentorship program.
Some of these girls and boys have given up hope. And that's why we came up with the mentorship program. Because sometimes you give up until you think it's not necessary even to continue going to school. So you identify these girls and boys, take them to school, but they give up hope. So we are saying we can do something, mentorship.
I was trained as a mentor by KEMET in collaboration with UNICEF. I was attached to Ring Road Primary School, where I'm implementing what I was trained on. I'm assigned 5 mentees. To me, the sessions are very successful because 1, I got new friends. I got to know what they do. I've learned a lot of things. The children open up. Some of them do it by saying, others do it in writing. Initially, there were challenges. First of all, there was no manual. We used to go there, a group of people who are trained. Then all of us just sketch a plan and work towards it. But today, this time round, we have a manual and a guide that helps us to plan our activities with the students.
KEMET takes a holistic approach to child development. In partnership with UNICEF, the organization provides various health services accessible to children and mothers. Support to children themselves includes physical facilities that motivates optimum learning in schools. KEMET has also trained some children to mentor their colleagues.
I've learned a lot from them, and I know that I'm going to spread. Like I've learned to be assertive, to interact with others, and to solve other people's problem, and also to solve my problem.
KEMET has helped me to know many things, and it has automatically changed my life. Like example, the first thing the KMET has helped me is to change my mind. I once was thinking of going back to streets before they taught us. I wanted to go to meet my friends there because the influence was still in me. But when they called us and talked to us, I came back to realize that I'm supposed to be in school.
This program that UNICEF in collaboration with KMET came up with is a very, very, very important project, especially for us in the municipality where we have so many children who are vulnerable. And if they are vulnerable and they are in their schools and teachers don't have that knowledge of providing psychosocial support, then these children cannot be helped. So it is important that this program continues and more teachers are brought on board so that all our teachers are aware and they provide for the needs of these children at the schools where they are working.
There have been some lessons learned during this period. For example, we have successfully created awareness that early childhood is not an intervention targeting children aged 3 to 6 only, but it also covers the child in the womb till age 8. So early childhood encompasses 0 to 8 years. And so we have created that awareness, and that has helped us to mobilize communities so that they are able to enroll their children in schools and also work towards retention. We have learned that there is a huge human resource that can be utilized in the urban slums.
Coming to an end of this beautiful journey that we started in 2012, what next? And most of the times, even the community start asking us, what next? So the first thing we want to make sure that we continue with the sustainability. We know that the community is now owning this program, and we just need to come up with the sustainability strategies. One of the strategies that we have is giving, UNICEF is supporting some funding, so some of the groups that I just talked about are going to be empowered financially, economic empowerment, and worked through the entrepreneurship skills process so that they can start their income generating activities and sustain what they are doing. We want to ensure that we continue with the enrollment. Most challenging part is retention. Enrollment is not an issue. How are we going to retain them? And as a team, as partners, we must really ensure that the children we have enrolled are retained. And mentorship is going to continue, and we'll work with those powerful women in the city to continue mentoring. We are going to lobby with UNICEF on behalf of the MVCs, especially the bills that are pending in Parliament, to make sure that their voices are heard.